gonna go down, right? I'm gonna feel like I have multiple personality syndrome. So, I would ask, right, one of you, right, okay, it's your turn to skills test. I'm gonna say, Dylan, your patient is here for a VCUG, okay? So now Dylan has to prepare, right, the room for a VCUG, okay? So, just gonna start by parking this, right, making sure all of the fluoro is set up, making sure that there's chucks, right, all over this table, right, towels, whatever, right, your department uses to soak up the absorbency, right, materials. He's gonna come over here, pull out, right, a couple of things. Need a catheter. I can't remember what we did with our tubing, but you should also have some tubing. You're gonna get the IV pole. You're gonna put this here, right? Kind of have everything ready, right, to go. Like I said, so there would be stuff set up for the procedure, right? So the materials that you need, plus, like I said, the room, right? So.
Do you have linens in the cupboard up here somewhere? Like a bunch of that? Towels,
I'll have it,
stuff?
yeah.
Okay.
Okay, so, right, we would get everything set up, right? And then Dylan's gonna go get his patient, right? So let's say the patient's exam, okay? So, right? Now, right, Dylan's gonna bring Xavier back into the room, okay? So now I'm gonna be Dylan. So like I said, I'm gonna have multiple personalities right now.
Can you be me also?
No. So, right, hi Xavier, my name is Dylan and I'm going to be right assisting with your exam today.
Okay.
Don't make me laugh. Okay, can I get your last name and date of birth, please?
It's Kobos and August 31st, blah, 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 1993.
Okay, great. So I've confirmed that, right? You're here for a voiding cystourethrogram. Does that sound about right?
Yes.
Yeah, I know those are a lot of big words. Sometimes we call it a VCUG.
Okay.
Does that sound like something your doctor talked to you about?
Yes.
Okay, good. So making sure that we have the right, we're here for the right reasons and the right patient, okay? Did you do any of the prep that the right doctor and the schedulers recommended? Okay, so that would have been a light evening meal, right? Did you void this morning, right? Did you make sure that everything's out that can be out?
Mm-hmm.
Okay, good. We are gonna, right, have you void one more time, right? So we're gonna have you go to the restroom, again, try to just get out as much as you can before we start the procedure, okay? Now, again, in the title of the procedure is the word voiding, right? So again, the purpose of this exam is to make sure that we take a picture while you are going to the restroom, right? So while you are urinating, we are going to actively be taking a picture.
Okay.
Which means, right, it's a little bit awkward. It's got all the things, and I, know that this is not the normal way of doing things, right? Everything in our body tells us that this is not what we should do, right? But we're asking you to do this just this one time, so we can take that picture, okay? But that does mean it does get a little bit messy. So, what I need you to do is to use this gown. I need you to take everything off: socks, shoes, underwear, all of it, because again, we don't want you to get messed up with any of your clothes. That's what this gown is for, right? So, leave everything in the changing room, just wear the gown, clothes is in the back, right? You can use these booties, because again, we'll put everything in our laundry, right, so you can go home nice and clean.
Okay.
Does that sound good?
Yes.
Okay, good. Go ahead and change for me, and use the restroom, and then come back, okay? So again, right, that's explaining a little bit of that procedure to the patient, right, so they know what to expect, what they're getting themselves into, okay? So now that you're back, I'm going to go through kind of what to expect during the whole exam, okay? So, the nurse is going to come in first, and they're going to place a catheter in your urethra. I know, this is really uncomfortable. So we have everything set up. They'll go ahead and do that.
Okay.
The radiologist is then going to come in. I'll introduce you, make sure that you know each other. And they're going to give you some instructions for what to do next. Okay? And what that usually includes is that they're going to start the flow of contrast. So it was over there when I was doing this on Monday. But, right, so there's this contrast. It's clear liquid. They're going to use gravity to kind of fill up your bladder. which means it's gonna get a little bit uncomfortable for a minute, right? As we fill that bladder, you're gonna feel that sensation like, oh, my bladder's getting very full, I have to urinate. But don't do that until, right, the doctor kind of tells you, okay? So that's gonna be the hard part about this, and it's gotta be uncomfortable for about 5 to 10 minutes, okay? Once the doctor's taken a few initial pictures, they're gonna take the catheter out, and that's where you get to, right, have your moment of glory, and we're gonna take some more pictures while you actively urinate, okay? So, like I said, I know this can be rough. If you're having a hard time, we can run some water, you can all look away for a minute, whatever's gonna, gonna be best to make sure that you're comfortable as you can be in this very awkward situation, okay? But we're just gonna do that as best we can, and then make sure that you tell the doctor when you are going so he can take that picture. So if we have to get that money shot, if we don't, then we have to do this whole thing again. And we don't necessarily want to do that. So like I said, just communicate with us, let us know how you're doing and when, right, those certain activities are happening, so we can get that picture. Okay? Does that sound fair?
Yes.
All right, you're gonna lay on the table for me. We're gonna get everybody in, and we'll get started.
Okay.
Yes.
Hi, Diane.
Yes. So yes, I would double check more of the patient history stuff, right?
Are we gonna be expected to go through all that, like just like the regular mock?
Yes. Okay. So confirming all of the paperwork that the patient has, right? But this is the type of instructions and communication that you're going to be mocking also during the exam, right? So how are you explaining this to the patient, right? So, okay, right? Then again, my other multiple personality, right, is that you call me in to act as radiologist, right? So, right, you've been talking, so Dylan, right, is talking, he's just giving this really great explanation, right, to the patient about what's to happen, walking through the next steps. Okay, I'm gonna go grab the nurse and radiologist. Woo, America, right? So, now as the radiologist, right, I will, don't forget to give me my lead, safety first. No, it's your job. And then, right, I'll fold the tube over and do all of the, mock. This is what I'm having him do, right? And then I'm gonna put it away and be like, okay, great job, Xavier, I'm gonna be all done. Now, for the VCUG, technically, right, there isn't anything because they would have done that already with the Fluor, right? So I wouldn't, but if this were a different type of exam, right, then that's when, as the radiologist, right, I might then look to Dylan and be like, hey, Dylan, can you do an AP, right? Or I need a post-void, or I need, right, I'm gonna tell you, something, right, I really want to see something, right? And then I would walk away, and that's when you would potentially do whatever it is I asked of you, right? So 1 picture, 2 pictures, whatever, right? And then there could be those times when I'm like, no, we're done. But later I might, again, ask, don't forget, right, that we need those 3, right, major pictures, like for an exopogram, right? So go back through, look at the video, take a snapshot, or make a still of the, right, the AP, the RAO, and all that. So then again, it's like you have to know what those are to do that. Yes.
Do we have to know the tower settings for each exam? We have to preset?
No, because these ones are a little janky. We don't want to activate the fluoro accidentally because it's really, really easy to hit those exposure buttons. So we're going to disable most of that. So no.
Do you want us to do the Trendelenburg for exams that need it, or do none of them need it?
So technically that's something that I would do as the radiologist, but you would need to support it, right? So I'd be like, hey, I'm going to do Trendelenburg, and you would run and grab the shoulder supports, and you would grab those things, right?
Okay.
So you're not necessarily going to do the Trendelenburg, right?
But I go get the pads.
But you would go get the pads and support the patient. Okay, does that make sense? Like I said, how we're going to mock this next week, right? So then, right, there's a final one more step, right? Again, I was the radiologist for a second, walked away, now I'm back to being Dylan. All right, so great job, Xavier, you did a really great job. I know that was super awkward, but you're all done now. So we're gonna have you, right, get off the table again. I'm gonna clean this up, and you can go ahead and get dressed. There should be supplies in there to clean, right, anything else that you might need. Get back into your clothes, and then come back and talk to me. There's a couple other instructions I have to give you before you leave.
Okay.
Okay? So make sure you help the patient off the table. And yeah, careful, right? Back to the bathroom. Good. Clean, right? While the patient is dressing.
Mhm.
Okay?
Is
Yes.
the thank you. I raised my hand with my face. Is the patient peeing on the table?
Yep.
Okay.
They're just peeing all over their legs. Just
Sometimes there's a container, sometimes there isn't. That's just
Yeah.
depends.
So for males, sometimes they'll actually use a container-ish, but for females, not as much because again, they're trying to get that urethra, right? And it's really short. So if we used something that could potentially block that, then
Yeah.
not so much. So again, it is awkward of all awkward. So granted, this is also kids,
Sitting there,
so the bladder capacity is a little bit smaller,
Mhm.
right? So the
Contrast.
volume isn't as much as we think it is.
Mostly.
Yeah, at least it's
Yeah.
contrast.
Mostly.
It's mostly contrast, yes.
Yeah,
Interesting.
not urine.
that's what the avoiding.
But it'll be
But yes.
Poop?
Okay.
like a bee.
I get that's different, yeah.
Better than that.
So, okay, great.
Yeah.
So now that you're all done, there's just a couple of things we want you to kind of be on the lookout for next couple of days, okay? So, because of that catheter placement, right, your urination for the next couple of days may be a little bit awkward, right? You may still have some burning sensations and things like that, but if that persists for longer than a day, right, make sure you make an appointment with your doctor. If you see any blood in your urine or if your urine changes to a really, really strange brown color, go to the ER immediately, okay? But other than that, like I said, you should feel things go back to normal within a day, okay? The results will be also ready in a day or two, so check back with your doctor and I'll discuss the results with you, and you should be good to go. Do you have any other questions? Okay. Again, just stay hydrated, keep your kidneys functioning and everything getting out of your system A-okay.
Thank
Alright,
you.
have a good day.
You too.
Not
Bye.
urine in the mouth.
It's blood.
No.
Yeah. So not everybody's bloody urine is pink, sometimes
blood
it's brown.
pressure.
Yeah.
Mhm.
So again, it's also if you have really bad reactions, like is super dehydrated, which can sometimes happen with contrast, also you get really brown urine.
Mhm.
So any of those sorts of things those are bad signs. You should go to the ER.
Mhm.
So, but again, that slight burning sensation, that is fairly normal for the first day. Like I said, if it lasts for more than one day, then you want to follow up because potentially you got an infection, right? So you got a UTI
Mhm.
from the catheter.
Mhm.
So, real fun. You know. But, right, and then I would make sure that I cleaned everything up and
Mhm.
finished up the exam. Yes.
Are we gonna have to do like the sterile prep and then with the gloving and all that stuff?
No, because again, that would be the nurse that would do.
Oh, the catheter.
Insertion.
Yeah.
Gotcha.
So, again, we would potentially have the supplies out, but you wouldn't do it, no.
Mhm.
Yeah.
Okay.
Where do you have like kits for this stuff? Like, is there like a PE kit or anything like that, or is it kind
So
of
it's
just-
kind of, yeah, finding what's in the cupboard that's close enough.
Okay.
And if you don't really see what you think you should, then you would state to, again, me as the proctor now,
yeah,
right?
Yeah.
Oh, I have these other, right, towels here, I've got this,
Yeah.
you know, gauze, I've got this if I don't have it.
Okay.
Doing my best to try to have stuff out here, but if there's something that you don't find or can approximate with, then
Okay.
say it out loud.
Okay.
No.
Do you, some of these exams, you might have like a recovery, like they usually they monitor for like half hour to an hour for the
Mhm.
contrast. Did you mention that in your thing, or would I mention that?
You would, yes.
Okay.
So again, that's in your instructions to your patient, right?
Okay.
Hey, you're gonna lay here for about a half an hour, right? I'll come back in and check on you in a second, or,
Okay.
you know, periodically, right? That's part of your explanation.
And then during the initial explanation, do you talk about like mild side effects or like with contrast stuff, just like this, if you feel like metallic in your mouth or like that's kind of normal, but let us know,
Yes.
something like that?
So this particular skills test is more about communication than it is going through the actual like positioning, right?
Okay.
Because the most important part of assisting with fluoroscopy exams is your communication with the
Mhm.
patient and with the doctor, okay? Again, the setup and those sorts of things, that's important, to, but it's going to change a lot when you go from place to place, right? Doctor's preferences. So your most important tool, the thing that you need to practice the most, is your communication, right? How do I explain this to the patient? How do I communicate with the patient? How do I communicate with the doctor?
Yeah.
Right? How do I communicate what I'm doing to my coworkers? Right? How do I communicate what I need? Right? Materials wise, what do I communicate? Right? That's the biggest part of doing fluoroscopy is using your mouth, right? To make sure that you can say what you need to say, when you need to say it, right? And using, right, those words. Okay, so practicing that is the key. Okay? And then going through, like I said, the motions as best that you can.
And putting the patient at ease.
Yeah. Okay?
And we're preparing for all 6 or all 7 exams, and then you'll decide which one we do.
So because I use the VCUG as the example, that's not the one I'm going to ask of you to do. But the other 6, they're all up for grabs. Okay?
Yeah.
So yes, somebody's getting a BE. Right?
Will you tell us like double contrast and
Yeah. So that will be part of me as the proctor giving you what the exam is.
Can you just assign one?
Yes.
No. Because then you'll only focus on that one. And I need you to study all of them.
Before the final. Awesome.
You need to know them all for the final anyway.
Oh, yeah, sure.
So, right? You can do this, I promise. So, this week or tomorrow, right? If you haven't already, check out your, right, department's kind of procedure books when it comes to fluoroscopy.
What if we don't have one?
If you don't have one, it's in your textbook.
I mean, kind of, but I will say, because I have done
Yeah.
all of them through BE with my instructions, it is seriously lacking in patient explanation, like
It
what
is.
you're doing, and so, like for example, like the one you just used, like oh, if you have any brown in your urine, like that's not in there, So I just feel like we're gonna be graded on stuff like it's like maybe we'll find it in Google, maybe we won't. So
So this is where it's like, query the field that you, right, the resources that you have available to you, right? So you're going to be still working with technologists that maybe it's been a while since they've done one themselves, since they all probably had to do it in school, but just ask them, okay, what would you say, right? If you had to explain post-care instructions for somebody, right, that had a urology study, what's the things that you would want to let them know, right? Or what was the craziest one that you've ever seen, So ask about that, right? Get some of that experience so that you're thinking about, okay, what would I say in those situations? How would I explain that?
And worst comes to worst, just make an educated guess. Like BE, hey, you might have some flatulence for the next day or two, but maybe that's normal. I don't know. But I'll just say it.
Yeah, no, that's a good point, right? So what is going to be very visible, right, after somebody's had any barium contrast? Again, whether or not they took it orally.
They're
or
gonna have
rectal.
white substances for the
They're
couple.
gonna have white stool for a couple days, yeah.
Yeah.
Okay.
And then they may have blood in their feces
so
at all.
again, that should not, yeah. So those are the things. It's like, yes, you're gonna have white. That is expected, right? Because we gave you this kind of contrast. But what if they use gastroview? Right? Then that's not part of that exam, right? So again, making sure that your instructions are appropriate to what you're using. But you got to think about it, right? Like I said, yes, that seems fairly, like now that you're thinking about it, like, oh yeah, of course, if I have, just consumed barium, it's got to come out somehow, right? And it's going to come out in my poop, and I'm going to see white for days, right? But if I have gastroview, it's not white, right? It's a clear substance. They might not notice that much of a difference. But if they've had a perforation, right? That's the reason why we use gastroview in the first place. Then yeah, you're going to be like, hey, if you notice an increase or a change, and right, there is a different color, like it's black, that's no good. Like you've got blood in your stool, and that's a perforation that's bad, right? So, yeah. Those are things we don't necessarily alarm our patients, but we do want to give them a heads up of things to look out for so that they know when they need to, seek that additional help and concern, right?
Are we allowed to write down like our questions like on a clipboard for a patient? Like,
Yes.
So we're like, can we have our own notes almost?
Like a speech
well,
right
it was
now.
just, it was not like the speech, but it's like my key points of things that I need to ask. You know, like previous abdominal surgeries, like.
Yeah, because you would have that.
Look, if I'm actually a tech, I'm actually gonna just do that.
They do have.
I'm just gonna have a list, just a
Hospital has
checklist.
like clipboards, checklists for like their techs when they go in.
So
Are we allowed to prepare that for ourselves?
Yeah.
Okay.
Okay.
Cool.
Good to know.
again, that should be in your technique books anyway, right?
Yes.
So that would be good information to put in your technique books as you are, right, learning that from your various sites, as you right talk to each other, right?
Yeah.
Again, there's going to be variations in protocols, but right, those protocols were given for a reason, and so even if not everybody does it, it's still good to know, like as an option. Hey, this might be something I can ask. Right? Why would you ask that? Oh, because of this, right? So, this is kind of one of those, yes, you do need to do your own homework a bit in the background to kind of be thinking about what would I say in these situations, right? What are the questions that I could ask that would help me make this process easier, right? For both the patient and myself, right? So yes, I should have started off with, are you allergic to iodine? You know, so
Okay.
those are important, yeah. Okay?
Shellfish.
Shellfish, yeah. If you ever had a reaction to contrast before, right, there's some of those sorts of things. But
Okay.
I was also giving you more of the example of, like, how do I introduce the procedure to the patient, right? Because we didn't really do that on that before, but. No, the other questions about, you know, allergies and history we went over in lecture, so hopefully you got those pieces already.
But just to clarify, should we be including that in this, or are we gonna?
So if you look back at your syllabus from the very first day,
Yeah.
right, the rubric for this procedure or this skills test is
Yeah.
there. So there's a big piece of it, like I said, right, sections of did you do the room prep, did you do, or question and patient's prep, whatever it may be, were you NPO, did you void, did you, whatever it is, right?
Okay.
So room prep, patient prep, right, procedure explanation, right, procedure assistance, follow-up protocols, right, all of so those are each a category, right, that you kind of have to hit for this skills test.
Did you post that rubric somewhere?
It's
Or
in
is
your
it-
syllabus,
Okay.
okay?
I'll check that out.
Yeah.
So I gave it to you, I didn't put it digitally, I gave it to you.
Okay.
Can you give us another copy?
No.
Wait,
I remember getting a paper for this one of the classes.
I gotta go find it.
Yeah, no, I gave you one for this class, so.
Okay.
All right, any other questions?